The chair now recognizes the gentleman from California.
Thank you, Mr. Speaker. I'm honored to be here today to introduce my amendment to H.R. 986, the Strengthening Healthcare and Lowering Prescription Drug Costs Act. My amendment promotes transparency and accountability to how the Trump administration is spending Affordable Care Act, ACA user fees. For nearly 2 years now, the Trump administration and Republicans in Congress have tried and failed to repeal the ACA. Had they been successful, 23 million hardworking Americans would have lost their health insurance and been left with nothing. No health security for themselves, their children, or their families. When those efforts didn't pan out, the Trump administration and our friends across the aisle turned their attention to sabotaging the ACA, dismantling the law piece by piece. First on the chopping block, they shorted the ACA enrollment periods by over half, from 92 days to 45. Less time to make a decision means less participation. Next up was cutting funding for consumer education and outreach. Not just a small cut, but a reduction of 90%, from $100 million to just $10 million. The goals are clear. Let's keep public health care options a secret, and let's make it as difficult as possible to insure yourself and your family. Funding for vital navigator programs was slashed by 40%. This was a move the Government Accountability Office, the GAO, itself described as quote-unquote problematic. But it's much more than problematic, it's detrimental. It's clear their goal is, and always has been, to drive ACA enrollment down to zero. Last year, the administration began allowing insurance companies to provide junk insurance plans, plans that, for one, don't protect consumers with pre-existing conditions. Now the administration is pushing the ACA navigators to promote these junk plans, advertising these plans as somehow comparable to qualified ACA plans that provide full protections. Obviously, consumers are going to be confused by this. The GAO found that the drastic reduction in outreach and advertising, quote, likely detracted from the 2018 enrollment. That's not likely. That's a fact. This is unacceptable and works directly against the intent of the law, which is to get more people health care coverage. For some reason, this administration thinks that having uninsured Americans is a good thing. My Democratic colleagues, the American public, and I believe differently. In my home state of California, we saw the value of investing in the ACA consumer education and outreach. The way to get people covered and reduce uninsured rates is to educate consumers about their health care coverage options and to make sure they know that health care insurance is affordable and within reach. Having strong consumer outreach and enrollment activities can, in fact, lower premiums. This is exactly what we found in California. Our state program, Covered California, estimates that its outreach activities lowered premiums by up to 8% for all consumers. This is basic economics. More participants equal lower costs for everyone. That 8% reduction amounts to some $576 million in our state alone. That, my friends, is a great investment. There's a clear intent by this administration and the Republican members to undermine the Affordable Care Act by drastically reducing vital funding for a fully functioning marketplace. And who does that hurt? Everyone. This administration intends to jam the spokes on the progress the ACA has made to increase the number of people with health care coverage. Congress and the American people deserve answers to these attempts to subvert the ACA. First, we need to know what the administration has been spending ACA user fees on if they aren't using these funds for education and outreach. We need to know why they're still charging states a 3.5% user fee to access a federal platform if those fees aren't being used for the purposes they were collected. And naturally, we need to know why there was a recent increase in user fees for state-based marketplaces. Talk about a rate tax hike, my amendment seeks answers. It requires an annual report to be submitted to Congress that includes a detailed breakdown on spending for 1, outreach and enrollment, 2, the Navigator program, and 3, the maintenance of healthcare.gov and the call centers. No one should be denied or dropped health coverage because they're a senior, pregnant, or get sick. Healthcare is a right, not a privilege, and everyone deserves access to quality, affordable care. It's critical now more than ever for us to receive answers on how ACA user fees have been spent over the last 2 years by this administration. I urge my colleagues to support my amendment, and I reserve